Surgical site infection is a common risk of any procedure. Post-operative infections may present as redness of the skin, such as cellulitis, or a deeper-seated infection that can continue as an abscess. Surgical site infections may present initially as redness of the skin, warmth of the tissue, swelling, purulent drainage, or fevers and chills. Symptoms typically appear within 5 to 10 days, but can rarely occur as early as immediate postoperative to more than 30 days after a procedure. Risk factors for surgical site infection include, but are not limited to, obesity, nicotine use, diabetes, chronic medical conditions, and immune dysfunction. Some of the ways to help limit these risks include proper surgical site prep, antibiotics at the time of surgery. Typically, these are a single dose and you will not be sent home with antibiotics except in select circumstances, optimizing blood sugar control for diabetics, and optimizing nutrition. If you have fevers and chills, this can be a sign of a more severe systemic infection. It is very important to recognize the symptoms of a rare but very dangerous infection known as necrotizing fasciitis. If you have redness that is rapidly spreading over hours or even faster, this is a surgical emergency. Call your physician and proceed to the ER for emergent treatment. To treat surgical site infections, often the first line is antibiotics. If there's an abscess, we may need to drain this. Less common, we have to proceed to the operating room for a formalized surgical washout. Do not be surprised if a drain is placed or if the area is left open with dressing changes to allow this to heal over time. Delayed presentation of infection can lead to systemic symptoms, tissue loss, sepsis, and be life-threatening. For this reason, early recognition and treatment is paramount. Surgical site infection is a relatively frequent complication after surgery, with rates ranging from 0.5 to 3% despite appropriate management. However, typically, these are easily managed. It's important to recognize the signs and symptoms of infection, and especially more severe infections, and seek treatment early to limit the adverse effects.